You book a doctor's appointment, you collect a prescription, you wait in A&E. Every detail is recorded, just not by the NHS. This isn't about medical notes or privacy data. It's about whether your health is a private matter or just another data set for a tech company. And right now, that privacy doesn't sit with your doctor or your government, but with a company you've probably never heard of. I spent time trying to find out who really controls our data. And what I found was the biggest corporate takeover in NHS history, and most people have no idea it's happening. This is the story of how a CIA spy company turned Britain's health service into a £480 million dependency.
The coronavirus is the biggest threat this country has faced for decades.
March 2020. Britain's hospitals are collapsing. Doctors have no PPE and patients are stacked in corridors. It's the start of a national crisis, and the government is already desperate. This is when an American company appears at number 10. Palantir offers to build the NHS COVID data store, the back-end system used to track hospital beds, PPE, and patient data throughout the pandemic. They do this all for the price of just £1. Now, it sounds like charity, but here's the truth. Under emergency pandemic powers, the standard competition rules for government contracts were suspended. There were no tenders, no rivals, no public scrutiny. Palantir was able to gain access to your data for just £1. And within months, government officials were planning much bigger contracts. According to reports, Ming Tang, the NHS's most senior data officer, the person responsible for building and running national data platforms, helped coordinate this plan. Leaked internal emails read, "This provides a total of 26 million for Palantir, higher than our previous ask of 24 million. Tang's reply, "We are trying to keep Palantir to 10 to 12 million per year." While doctors were fighting for PPE, Whitehall were drafting budgets to funnel tens of millions to Palantir. The £1 contract became 25 million, then 60 million, and by 2023, it was 480 million for the Federated Data Platform, the single most ambitious data project the NHS has ever attempted. The pitch was simple. Replace outdated paper files and fragmented systems with one unified platform. GP appointments, prescriptions, blood tests, waiting lists, the lot. In layman's terms, it's a single searchable map of every patient in England. And on paper, it's sold as efficiency. But in reality, it puts the health records of 55 million people inside the servers of an American tech company. But who is Palantir? And why should this terrify you? 2 years after 9/11, the CIA's venture capital arm funds a startup with a simple remit: build software that can integrate any database and give governments the power to see everything. They name it after Tolkien's Palantir, the all-seeing crystal that corrupts anyone that uses it. Behind it is Peter Thiel, PayPal co-founder, early Facebook investor, the billionaire who believes that freedom and democracy aren't compatible. He's called for floating cities beyond government control where corporations rule directly. A conservative libertarian who spent 15 million pushing J.D. Vance to the Senate. He once described Britain's love of the NHS as Stockholm Syndrome.
You would prefer the human race to endure, right? You're hesitating.
Yeah, well,
Yes?
I don't know. I would.
This is a long hesitation. This is a long hesitation.
There's so many questions implicit in
Should
this.
the human race survive?
Yes.
Okay.
He thinks your attachment to free healthcare is a mental disorder. And then there's Alex Karp, Palantir's Machiavellian CEO, a philosopher turned data warlord who openly boasts about what his company was built to do.
We have dedicated our company to the service of the West and the United States of America, and we're super proud of the role we play, especially in places we can't talk about. Palantir is here to disrupt and make the institutions we partner with the very best in the world, and when it's necessary, to scare enemies and on occasion kill them.
For 2 decades, Palantir has powered the darkest corners of American security state. The CIA, the NSA, the Pentagon. Its platform Gotham was used to locate Osama bin Laden, pulling satellite feeds, bank transfers, and phone records into one searchable map. It powered mass surveillance programs later exposed by Edward Snowden. The same system helped ICE agents plan raids and separate families at the US border. In Los Angeles and New Orleans, Gotham's predictive policing dashboards flag minority neighborhoods as crime zones. It's used by Israeli defense forces in Gaza, mapping civilian populations and combat zones. This isn't something niche. Palantir's products are embedded in governments, armies, police forces, banks, and corporations across more than 40 countries. The same machinery built for war, surveillance, and deportation runs our health service. Control isn't random. It's designed. Systems don't just drift into the hands of a single company. Someone steers them there. Every door that's opened for Palantir was opened by a person with power, influence, and access. So the question becomes, who made this possible? As we all know, the NHS isn't one single organisation. It's a patchwork. NHS England sets the national priorities. Local hospital trusts deliver the care. Then there's specialist units like NHSX, set up to drive digital transformation, and NHS Digital, which managed data and IT. In theory, this division spreads power. In practice, it creates silos and opportunities. If you win over the right people at NHS England or NHSX, you can shape decisions for the entire system. And according to the Bureau of Investigative Journalism, Palantir was working those insiders long before the pandemic. July 2019, Palantir's UK chief Lewis Mosley hosts a private dinner with David Pryor, chair of NHS England, the night before NHSX was launched. Emails show Pryor thanking Mosley and inviting him to suggest how Palantir could structure and curate NHS data. By January 2020, the Department of International Trade was actively looking at how to support Palantir's UK growth, including recruitment, visas, and office space for expansion. By the time COVID hit in March, Palantir already had a UK-specific health product. The £1 contract wasn't the start of the relationship. It was the moment years of courting had begun to pay off. In early 2019, ex-MI6 chief Sir John Sawyers introduced Palantir CEO Alex Karp to John Manzoni, the chief executive of the civil service. And in 2022, NHS head of AI, Indra Joshi, left the NHS and moved to Palantir, just 1 year before the £480 million contract was signed. Now these might sound like coincidences, but look at the pattern. Elite introductions, support from government, use of emergency powers, and insiders crossing over. The crazy thing is, out of 36 NHS trusts that tried Palantir, only 8 reported benefits. So the government paid KPMG £8 million to convince hospitals to use Palantir anyway. So your government spent your money not on care, but on PR for the spy company. This isn't efficiency, it's dependency. And once you're hooked, you can't leave. In 2017, the New York Police Department tried to break up with Palantir. When they ended their contract, Palantir refused to return their own data. Years of criminal intelligence locked inside Palantir's servers. The NYPD had to start again from scratch. And that seems to be the Palantir model. They get in cheap, become impossible to remove, and then raise the prices once they know you're trapped. The NHS is already showing addiction symptoms. By 2024, fewer than a quarter of hospital trusts were actively using Palantir's software. But the truth is, the NHS was just the beginning. Because while everyone focused on hospitals, Palantir was spreading everywhere. Policing, defense, border control, every core function in Britain. Project Nectar connects 14 police forces through Palantir's real-time data. Your political opinions, union membership, your religious beliefs, all integrated into profiles. A £27 million Cabinet Office contract was awarded without tender and then cancelled due to budgets. An £80 million defence contract. Palantir now decides how Britain wages war. Each justified by emergency, each impossible to remove once embedded, and each one creating pressure for the next expansion. You see, Britain has no single written constitution, no overseeing document that sets clear, permanent limits on emergency powers. Parliament is sovereign, so checks on institutional expansions are mostly political and not legal. During COVID, emergency rules overrode normal procedures. So when Palantir was awarded contracts without full public scrutiny, there was no legal or legitimate way to challenge it. In America, courts can point to specific constitutional clauses. In Britain, everything depends on convention and good faith. And this is how democracy dies in the 21st century, outsourcing to organizations where privatized power becomes too essential to take back. History shows that power expands until it meets resistance. The question is never if people will fight back, only when. And now, the backlash is building. The British Medical Association calls Palantir an unacceptable partner. Doctors warn the deal threatens public trust. YouGov found 48% of adults would opt out of NHS data sharing if they knew private companies were running it. Many don't know it's already happening. Good Law Project and Foxglove launched legal challenges, but when they tried to read the contracts, 417 out of 586 pages were redacted. Every fact I've shared comes from Freedom of Information requests, parliamentary questions, leaked documents, and some brilliant work from journalists, proving that the tools of democracy still work if we choose to use them. So contact your local MP about Palantir contracts, support legal challenges, and share this video as many have no idea it's happening. By 2030, every interaction you have in Britain, from healthcare to benefits to policing and taxation, all will flow through American surveillance systems. Your children will grow in a country where Silicon Valley corporations know more about their lives than you do. We're at a moment that will define Britain for generations. One path is where algorithmic control becomes normalized. The other is where democratic resistance forces accountability. The window for resistance is closing, but it hasn't closed yet.